I will talk about the basics of brain perfusion and metabolism. Normal values of global cerebral blood flow are 40 to 50 milliliters per minute per 100 grams of brain tissue in the whole brain. Gray matter is reported to have a flow rate of 80 milliliters per minute, about 4 times higher than white matter, which has a flow rate of 20 milliliters per minute. Cerebral blood flow is reported to carry 5 to 10 times the amount of glucose needed to maintain the brain, and 2 to 2.5 times the amount of oxygen needed. The resting cerebral glucose metabolic rate in a healthy adult is 0.2 to 0.3 micromoles per gram of brain tissue per minute. Let us assume that the amount of glucose metabolized is 0.25 micromole per gram of brain tissue per minute and that the brain weight of an adult is 1400 grams. Then the brain consumes 91 grams of glucose per day. This means that it is consuming 23 teaspoons of sugar or 23 sugar cubes. On the other hand, the resting total brain oxygen metabolic rate of a healthy adult is 3.3 to 4.2 milliliters per minute per 100 grams of brain tissue. In terms of moles, this is 1.5 to 1.9 micromoles. This means that per day, the brain consumes 68 to 86 liters of oxygen. As for air, if the oxygen concentration is 21%, it consumes 324 to 410 liters. In the body as a whole, the brain weighs only 2%. However, the brain accounts for 16% of the body's total blood flow, 20% of the body's total oxygen metabolism, and 25% of the body's total glucose. Factors that affect cerebral blood flow include the following. First, blood pressure. Cerebral blood flow is kept constant by automatic regulation of the vascular diameter, with a mean arterial blood pressure between 60 and 150 mm of mercury per milliliter of mercury column. Below this range, cerebral blood flow decreases. Above this range, cerebral blood flow increases. If intracranial pressure increases, cerebral perfusion pressure decreases and may fall below the autoregulatory range. The partial pressure of carbon dioxide in arterial blood has a significant effect on cerebral blood flow. A change in carbon dioxide partial pressure of 1 mm of mercury column will change cerebral blood flow by approximately 4%. Carbon dioxide partial pressure and cerebral blood flow are positively correlated. Blood viscosity also affects cerebral blood flow. In true polycythemia vera, viscosity increases and cerebral blood flow decreases. Conversely, cerebral blood flow increases in severe anemia. Neuronal activity due to sensory stimulation or task load also increases local cerebral blood flow. In this case, global cerebral blood flow does not show significant changes. Cerebral blood flow is redistributed by increasing blood flow to active brain regions and decreasing blood flow to other regions. Also, as we age, cerebral blood flow decreases, especially in the frontal lobes and the area lying around the sylvian fissure. Let me explain more about autoregulatory capacity. We explained that cerebral blood flow remains constant when mean arterial blood pressure is between 60 and 150 mm of mercury column. The range in which this autoregulatory capacity is maintained has shifted to the right in chronic hypertension. In this condition, the blood pressure at the lower limit where the regulatory capacity is maintained is elevated, so caution is required because a sudden drop in blood pressure may cause a decrease in cerebral blood flow. In addition, in conditions where autoregulatory capacity has been disrupted, such as in acute stroke, blood flow increases as cerebral perfusion pressure rises. These are changes in cerebral blood flow due to visual stimulation. With closed eyes, compared to open eyes, blood flow in the occipital lobe is extensively reduced due to reduced visual input. These are changes in cerebral blood flow due to auditory stimulation. Listening to a story shows an increase in blood flow, especially in the auditory cortex of the left temporal lobe. Changes in cerebral blood flow with normal aging. Comparing younger and older adults shows that blood flow is reduced in the frontal lobes, particularly in the anterior cingulate gyrus and perisylvian cortex, in the elderly. The statistical analysis on the right side clearly shows the extent of this decline. Global cerebral blood flow also shows a mild decrease with age. The age-related decrease in blood flow is more pronounced in the cerebrum than in the cerebellum. Children show higher cerebral blood flow and metabolism than adults. The highest cerebral blood flow is seen in school-age children, which is about 60% higher than in adults. Neonates and infants show cerebral blood flow changes due to brain development. Soon after birth, high blood flow is seen in the pericentral sulcus, thalamus, brainstem, and cerebellar vermis. Later, blood flow increases in the occipital, parietal, temporal cortex, and cerebellar hemispheres. At about 6 months, blood flow in the frontal lobes begins to increase and continues until about 2 years of age. In children, blood flow in the cerebellum appears to be lower than in the cerebrum. With aging, cerebellar blood flow is relatively high and cerebral blood flow is relatively low. This means that a normal database is needed for each age group. I describe the normal image of brain perfusion. Spect brain perfusion on the left and right hemispheres are nearly symmetrical. The gray matter shows higher blood flow than the white matter, and the white matter and ventricles cannot be distinguished from each other by Spect resolution. With eyes closed, occipital lobe blood flow is reduced. MRI and brain perfusion Spect are looked at in turn from the cerebellar level. In the cerebellar hemispheres, the cortex shows higher perfusion than the medulla. Pons level. The ventral part of the pons has more white matter and shows lower blood flow than the dorsal part. Midbrain level. The midbrain also shows an uneven distribution of blood flow due to the mixture of gray and white matter. Basal ganglia level. It can be seen that blood flow is as high in the putamen, caudate nucleus and thalamus as in the cerebral cortex. It also shows that the globus pallidus, which has a high white matter component in the basal ganglia, has low blood flow. Lateral ventricular body level. It can be seen that blood flow in the white matter is low and cannot be distinguished from the ventricles. This is the level of the centrum semiovale. It shows low blood flow in the white matter. Next, I describe the normal image of brain glucose metabolism (PET). Brain glucose metabolism on the left and right hemispheres are nearly symmetrical. Gray matter shows higher metabolism than white matter. The cerebellum in young subjects has a relatively lower metabolism than the cerebrum. Brain glucose metabolism (PET) will be looked at in turn from the cerebellar level. PET provides more detailed assessment of metabolic distribution than Spect because of its higher spatial resolution. The dentate nucleus of the cerebellum has high metabolism. Pons level. The ventral part of the pons has more white matter and the dorsal part has more nerve nuclei, indicating higher metabolism on the dorsal part of the pons. Midbrain level. The cerebral peduncle shows low metabolism due to white matter. The red nucleus shows high metabolism. This is the lower level of the basal ganglia. It can be seen that the metabolism of the globus pallidus is lower than that of the putamen. Basal ganglia level. The metabolism of the putamen and insular cortex can be assessed separately. This is the level of the centrum semiovale. It shows low white matter metabolism. The following is a summary of the indications for brain perfusion Spect. These include detection of brain perfusion disturbances in cerebrovascular disease, evaluation of brain perfusion reserve, detection of hyperperfusion syndrome after carotid artery stenting or carotid endarterectomy, early and differential diagnosis of diseases manifesting dementia, detection of epileptic focus for epileptic surgery, early detection of encephalitis, and detection of functional abnormality in psychiatric diseases. Increased perfusion in the left medial temporal lobe in the acute phase of herpes encephalitis. This is a case of right hemianopsia after epidural hematoma surgery. There is extensive hypoperfusion in the left occipital lobe. This is a case of healthy elderly and Alzheimer's disease dementia. In Alzheimer's disease, there is decreased perfusion in the bilateral parietotemporal cortex. Depressive and remission phases of major depression. In the depressive phase, there is mild diffuse hypoperfusion in the left hemisphere cortex. Global cerebral blood flow is reduced to 35.5 milliliters per minute per 100 grams of brain tissue. During the remission phase, global cerebral blood flow increased to 39.7 milliliters and perfusion in the left hemisphere cortex also improved. Finally, two cases of schizophrenia are presented. On the left is a chronic case and on the right is an acute case with auditory hallucinations. In the chronic case, there is decreased perfusion in the frontal lobe. The acute phase case shows increased perfusion in the left temporal lobe, which may be related to auditory hallucinations. This concludes my presentation on the basics of brain perfusion and metabolism. Thank you for attention.